Reduction in patient days, pretty significant. We were at an average daily census at our highest part of 14.2 average census. 14.2 patients on average. Right now, we've gone from 12, 11 to 10.5. So basically, on average, we're only going to have 11 patients in the hospital in an acute care status. When Mr. Vonderfeck talked about 20 beds, this is related to acute care. Let's not talk about the outpatient factor, the observation beds. This is acute care inpatient. So we have not, in the past 12 years, had a situation where, on an ongoing basis, that we've needed more than 15 beds. There are days, we all know there are peaks, but on the majority of the time, we're looking at 14 days. Long term, another opportunity for growth. You can see we've been very stable on admissions throughout the time. But in this past year, we've had a significant change. What we did is we found with the change in reimbursement that we needed to focus more on rehab patients. Set aside a certain number of patients, be able to take those patients that are post-surgery or post-acute care, be able to buff them up in a rehab setting. That means more patients, but you will see less patient days. 2005 census, we saw a dramatic change in the volume of activity that comes through our emergency room. And our emergency room is our front door. If you think back to how level we were on admissions, think about if the volume that was coming to our ER was staying the same or going up, the volume that we could have been seeing. The next thing, surgery. Surgical procedures dropped off quite a bit. And what I found in my research was that Dr. Ford had a change in practice in 2008, and we started seeing a reduction. He still sees patients at our facility. Last year he saw 25. Dr. Goss, 188. Dr. Watson, 430. Again, we have one of the best quality surgery staffs you'll ever see. We've got an infection rate that is below minimum. I mean, I truly believe it's one of the best in any hospital that I've been in. And not to brag, but this is my 32nd hospital that I've worked in. So I'm talking from a very large number of facilities to be able to compare against. And our staff does a fantastic job. But again, it takes opportunity. It takes the patients being here, not driving past us to be able to get to where we can take care of the patient. Net revenue is cash coming in. This is what we anticipate our cash to come from. We've had a very nice increase over the years by providing new services, getting the functionality of the billing, even though despite all the activities that's gone on by reductions by Medicare, Medicaid, and commercial payers, we've still been able to do fairly good. In 2012, we started a great program that we thought was really going to be able to benefit us. It was insertion of pain pumps. We started working it. We started getting lots of volume. And the payers stopped paying for them the way that we had when we initially started working. The vendor would not come off the price at what they were charging us to match what the insurers were paying us. So we had to leave that program because it was not producing a positive bottom line for us at the end of the program. Accounts receivable. That's how much is owed to us at the end of the year by third-party insurers or patients. Then you can see we have done a fantastic job. All these years we've stayed very well. In 2012, we had a computer system change right at the end of the year. It caused us to have a standpoint of not being able to collect all the money due to our billing system change. So we had more money owed to us at the end of the year. Days in accounts receivable is a monitoring system that we use. This is how long an average takes us to get paid. In most everybody in the world, as soon as you get a service, you get paid. For us, it's an average of 60 days. We Yeah, the longer it takes us, because we have to go through electronic billing, then we have to bill the patient. We basically cover a lot of our patient accounts for nearly 2.5 months. Okay? The cost of care, and excluding depreciation, this is the true cost. This is the cost of the equipment, the patient caregivers, which is our nurses, our respiratory therapists, our x-ray technologists, lab techs, housekeeping, dietary, administrative services. Our costs have gone up, and you see that we are just below the $19 million in net revenue that we were looking at, which means we have about $200,000 to be able to pay for new equipment, pay for debt service. So our costs to take care of people is following right in line with what we believe our collection capabilities are. We have basically been operating right around break even, and as Mr. Bessett noted, we basically come down to $250,000 a year average loss. Now, this is a very interesting category. This is the cost of non-paid services. These are patients that cannot pay for the care, charity patients. And then there's the patients that choose not to pay for the care. Those are categorized as bad debt. We have, over the last 7 years, been averaging $1 million a year cost. So for the last 7 years, $7 million has been paid to take care of the population that cannot pay us and chooses not to pay us. So that's a big impact on the financial operations of an organization. Our liabilities, these are the debts that we owe at the end of any given year. And you can see, based upon the increased volume, we have gone up over the last few years. And then at the end of 2012, due to the computer conversion, we had some more outstanding debt, which is an anomaly. Our average payment period, which is one of the measures that Moody's uses to decide whether or not a facility can maintain its viability going into the future, we have, for many years, paid our bills within 30 days. We didn't get paid for 56, 60 days, but we paid our bills. For the national average, goes anywhere between 50 to 60 days because, again, we're matching what we pay out to what we bring in. Now, I want to quickly just cover a few things from the Spectrum report again. We presented on October 15th the results of our surveys, internal and external, to support or make the change in what we presented in July. One of the first things we looked at was operational financial metrics. There are 5 of them that we focused on: operating margin, operating EBITDA margin, days cash on hand, debt capitalization, and capital spending. If you know what's going on in these 5, you kind of have a good idea about where your organization's going. So the first one, as Mr. Bessett said, we averaged $255,000 a year average loss. Over these years, you see there was a nice bump here. Looks like to me, when I was going back and looking at the audits, we had a nice receivable from a third-party payer. And next year, that went away, and we took this as an expense. So we really have had significant losses over the last few years. And what that has impacted us is our days cash in hand. Your goal is always to have as much cash on hand as possible. At the end of 2012, with the change in the computer system, we had to borrow the money from the city at $800,000, and we still only had $400,000 worth of cash in the bank at the end of the year. Good is better. Better means up. The more cash you have, the better that you can handle the changes that are addressed from the external factors. Days cash on hand for us has declined from, at our high in 2001 of 52 days, we're now 6.6 days. Basically, what that tells you is that if we were not able to bill for anything else, we could pay our salaries and our suppliers till next Wednesday. And that's it. That's not a good thing to do. Like the triple B rated by Moody's in 2009 was 125 days. And we in 2009 were 15. Okay? We have been working, and the staff, the medical staff, everybody has been working very, very thin for a lot of years. Our long-term debt to capitalization, this is bad. Lower the better. We were in great shape at the beginning of the 2000s. We positioned ourselves due to the lack of cash to not be able to cover our debt in an adequate time frame. Cash flow to debt, again, the positive direction is up on this. We have not been. Fixed assets. This is where we've actually had to spend our money. We didn't borrow that much money. We tried to pay for most of our capital out of the earnings that we got on the day-to-day operations. In 2006, we added a professional office building. We added radiology equipment in 2008, and in 2012 we added the next-gen computer system. But the majority of the time, we're spending on an average of less than $400,000 a year. That is not a lot of money for capital equipment. That means that the people that are working at the hospital have done an outstanding job taking care of the equipment. They have babied that equipment. They have made it work for a lot of years. Which average age of plant, this one is another Moody's measurement. If you are above 10 years in age of plant, that means that you are not reinvesting your money back into your facility. And as you can see from we have not been less than at the 10 till 2002. We've been up in the 14, 15 years age. And if we hadn't had the building that we added in 2006, the radiology equipment or the next-gen system, that number would have been significantly higher. It would have been off the chart. Current ratio is just another ratio that Moody's uses. And good is better. This means how much current assets, cash, accounts receivable to pay the bills that you have at your door. Payroll, suppliers, anything like that, anything you have to pay in the current year. Net assets, that's basically what you have left in the savings account when you're done. Your owner's equity. And you can see that with all the losses that we've sustained, we've gone from being right at $8.5 million, come down a little bit to $8 million, and now we've been down on a steady trend. At this point in time, we're just above $5 million in owner's equity. And good is up on this one. Just to summarize, we had identified $2.3 million over the last 9 years, average loss of $255,000 per year. We identified that we were 5 days or less days cash on hand when we did the survey. The next-gen system was not put in as advertised to the staff. The company did not have the support staff to be able to install the system. And again, I have to applaud the hospital staff for everything that they did in building the next-gen system because they didn't have very much support from the company. They were very much in favor of selling equipment and not right there to support it.
Okay, the next on our agenda is the presentations on proposals from our attorney, John Quinn.
Thank you, Mr. Chairman. G, as the next one, I guess, to grab the microphone, I want to just thank you for presenting truly what sort of the local, state, and national factors that come into play that affect the performance of the hospital and really set the context in which the board has to make its decision and what guides the board. So that was very educational and informative. Thank you. Thank you, Mr. Chairman. And thank you to the board members. I'm going to go through 3 sections of what I have to say this evening. One is a little bit of background, one on the proposals, and a little section on implementing documents. And I know Mr. Bissett spoke about the history of this, what brought us here today. And there were a lot of different events, and there were many board meetings, many sessions. And I'd just like to highlight a few of the items to remind the board and inform the citizens on what the board, the documents the board has gone through, and the background the board has looked into in helping it make its decision. And I truly want to thank the board of directors for an incredible amount of work. Some people say when you leave school you don't have any more homework, but this group has had homework, you could say every night for the last year at least and longer, in studying, in learning, and in coming to conclusions. And so thank you for that. Some of the major items that we looked at and reviewed together were the charter of the hospital, the bylaws of the hospital. We reviewed a memorandum report regarding board conduct, the laws of Tennessee that guide the board of directors. We reviewed a guidebook for Tennessee nonprofits that the Attorney General produced. We reviewed the Attorney General information request. We studied the decision-making process. We discussed complex policies, questionnaires, confidentiality statements, and the statutes that guide a board in selling a public benefit hospital and entering into a transaction. I want to point out to the board, and we had studied this, and that as set forth in the Articles of Incorporation, or the charter that's filed with the Tennessee Secretary of State, the purpose of the corporation shall be to take care of the mental and physical needs of the citizens of Unicoi County and surrounding areas. In the bylaws, the purpose of the hospital is to provide, plan, and coordinate quality health care for the community. Those are sort of the fundamental tenets that guide any board in making these decisions. Next, I want to go to the specific proposals. And I might need another hand here, but I think I can manage. I'll do my best. Any proposal, the foundation for the proposals is the RFP process, request for proposal. And as was mentioned in July, late July, RFPs went out. And I want to remind everybody sort of the foundation for that request for proposal and what the Unicoi board asked of those bidding, or those who wanted to be involved. In the very beginning, it says, it is important to the citizens of Irwin and Unicoi County that we maintain an acute care hospital within the city limits of the town of Irwin. It's very much the premise of the request for proposal. Following that, the board wanted 4 items addressed. They wanted current operations of the hospital to be assumed, current financial obligations and debt to be assumed. They wanted the construction of an acute care hospital, and upon completion of that new hospital, they want the facilities disposed of in a manner that would benefit the citizens. So that's the foundation, that's what was asked for. And proposals came back, as Mr. Bissett said, the final proposal. They were asked to produce their final and best proposal. And Mountain States and Wellmont did that. Now, because the way the processes worked out, the Mountain States proposal basically was an initial proposal, which was then ultimately resulted in a letter of intent and an asset purchase agreement. The Wellmont proposal was reflected, what I'm going to talk about was reflected in their initial proposal. So importantly, both, to review those proposals specifically, both Mountain States and Wellmont, in their initial proposals, felt that they would become the owner of Unicoi County Memorial Hospital, or become its sole member. With feedback from the attorneys from both Mountain States and Wellmont, both agreed and both were flexible enough to move toward an asset purchase type transaction. The Board of Control here felt that that was a particularly attractive method because it made sure that Unicoi County Memorial Hospital would stay in existence to hold any buyer's feet to the fire to make sure a new hospital was built. As we talk about specific documents and how it's structured, you'll see how that takes place. In general, Mountain States agreed to continue the current operations, to pay closing date financial obligations, construct a new acute care hospital in Irwin, repurpose outdated facilities, provide a $2 million secured line, provide interim management pursuant upon the letter of intent being signed, and to contribute $750,000 to each of the town and the county. In addition, they were going to contribute $1 million to a foundation for unmet health care needs. And finally, capital would be invested for a facility, equipment, and information technology. Wellmont agreed to continue services that would be set forth in the letter of intent, to assume outstanding debt and provide a line of credit, to replace the facility pursuant to a planning task force and their determinations on that planning task force, to repurpose the facilities, to provide interim credit agreement or a line of credit, to provide interim management, to provide $600,000 to the town and to the county, and to invest in capital programs and facilities. So in general, you can see right now shaping up, many of the elements were very similar, but there were certain distinct differences. And so now I think it's an important point or a time to discuss some of those differences. Probably the most critical difference was the location of the hospital presented in the two proposals. Mountain States agreed to locate the hospital in Irwin, as set forth in the request for proposal, a minimum of 20 beds in Irwin, with the remainder determined pursuant to a comprehensive strategic plan. So they agreed to set a minimum, establish a minimum, to have a study with community leaders to ultimately determine an additional amount. Wellmont, on the other hand, agreed to collectively for 48 beds, but did not commit to building any specific number in the town of Irwin. A planning task force would be established to determine where the beds would be located. Specifically as to the point, because it's so critical, Wellmont specifically said that they may seek to maintain some inpatient care beds at the current facility, while have 48 acute care licensed beds located in Unicoi County, with beds remaining in the town of Irwin. Specifically, the hospital location would be determined by a planning task force. And Wellmont stated in its response that the planning task force would have responsibility for developing feasibility studies demonstrating the appropriate location for a new facility. They indicated, Wellmont recognized that it indicated in its initial proposal that it expected the most appropriate location would be closer to I-26 and in the northern portion of Unicoi County. Although in the second proposal, they said, Wellmont continues to believe that such a location may be attractive and beneficial. It's committed to a collaborative and deliberative process of planning that recognizes the needs and perspectives of its stakeholders. And that's why the planning task force would ultimately determine the location of the hospital. So I think that's a sort of location of the facility and how the two proposals addressed that was critical. Both sides agreed to provide a line of credit. Mountain States a $2 million line of credit, and they've agreed, as many of you have read in the paper, for an additional $1 million. Wellmont's credit extension, in one section it was, and I think this is what was intended, there was no maximum, but the draws would be approved by Wellmont. In another section of the agreement, the proposal, they mentioned $1.5 million line. But I believe what they meant, or what they proposed, was an unlimited line, but each draw would have to be approved by them. Specifically, and we'll get into this in detail because it addresses the Attorney General's concern, Mountain States agreed to provide $750,000 to the town of Irwin and $750,000 to the county. And Wellmont agreed to fund $600,000 to the town of Irwin and $600,000 to Unicoi County. Mountain States agreed to provide $1 million in funding to a foundation for unmet healthcare needs in the county, and Wellmont did not address that. As far as liabilities, Mountain States agreed to pay at cost at closing liabilities, which at that time were $6,349,000. Wellmont similarly said they would assume outstanding debt at the closing. As far as interim management, the proposals were very similar. Mountain States would have an interim hospital administrator. Wellmont would assume operations and assume the responsibility of the presidency. So very, very similar. Mountain States would provide capital after the closing but prior to the building of the hospital to ensure critical needs at the hospital are met. They would integrate technology into that used by Mountain States. Wellmont would invest in capital to enhance local services and again utilize the planning task force to determine more those investments. In repurposing, both Mountain States and Wellmont addressed that. And Mountain States agreed it would be part of their strategic planning process, and Wellmont called it their planning task force to address those repurposing of the facilities after they're used, or after transferred to the new hospital. With respect to hospital personnel, which was extremely important to the Board of Control, both Mountain States stated the CEO will be a Mountain States decision. They would employ all with the Mountain States pay ranges and benefits. Seniority would transfer, and future staffing would adjust in accordance with needs and performance, and physician contracts would be continued. Similarly, Wellmont said they'd employ all with Wellmont benefits. Seniority would transfer. Employment would be contingent upon background checks. As far as contractual employees, they would be continued, and the physicians would become part of Wellmont. Those are the sort of main elements and differences in the proposals. I want to briefly speak of another sort of compare the organizations as far as just some financial factors. Both are reputable, certainly wonderful organizations. Mountain States is larger on a number of criteria. Mountain States has more licensed beds. The revenue, net revenue for Mountain States was $1.1 billion in 2011, and the net revenue for Wellmont was $797 million. They were both BBB+ rated by Fitch. The net assets at the end of 2011 were $1.9 billion for Mountain States and a little over $1 billion for Wellmont. Then in 2012, those numbers were very similar. Total assets, $1.9 billion for Mountain States and $1.096 for Wellmont. Total revenue, gains and support, $991 million for Mountain States and $789 million for Wellmont. So both larger organizations, certainly, both systems, both have won awards. We've distributed their views on their mission, vision, and values. So that's a little bit of the background on the proposals in some detail. Now, I'm going to go through some of the implementing documents. From the Wellmont perspective, the proposal would then be transferred into a letter of intent. During the letter of intent phase, due diligence would occur, and then resulting in ultimately in an asset purchase agreement. That's exactly what transpired on the Mountain States side. The initial proposal took place, a letter of intent took place, and then ultimately result in an asset purchase agreement. So we reviewed the proposal on the Wellmont side, the documentation doesn't go further. I'm going to go a little bit further on the asset purchase agreement side, because that would be the implementing document. The implementing document on the Wellmont side would be a letter of intent. The implementing documents we have the furthest along is the asset purchase agreement. And again, you've reviewed these documents yourselves. You've reviewed them in individual sessions with attorneys. You reviewed them in previous meetings, and I'm going to review it again. And again, this enables the entity to remain in existence, to hold a buyer's feet to the fire, to make sure they do what they say they're going to do. If a failure to build a hospital, assets would revert back to the entity, and so the hospital can function. The main elements of the transaction with Mountain States are an asset purchase, lease of the land over to Mountain States, and a purchase of the improvements on that land. And again, through different documents, a ground lease agreement and a return of property agreement. In the event Mountain States failed to do what they said, the lease would terminate on the land and the purchased improvements would revert back to Unicoi County Memorial Hospital. So in an asset purchase agreement, just generally, almost every asset purchase agreement you see has a section dealing with what assets are being purchased, what liabilities are being assumed when the closing takes place. The seller makes representations to the buyer. The buyer makes representations to the seller. Certain covenants are made by both sides or agreements. And then there are conditions to closing that take place. There's provisions as to termination, indemnification, and then just sort of miscellaneous clauses. I'm going to go through the more, and I know, again, we've gone through this. I'm going to go through some of the specific clauses that are most critical. In the Mountain States Asset Purchase Agreement, Mountain States agrees to purchase substantially all the assets of the hospital, of Unicoi. There are several excluded assets, but by and large, they buy the assets, the supplies, the deposits, the receivables, really the entire business. Certain assets are excluded, and including the hospital land, which gets leased over to Mountain States. Mountain States certainly agreed to assume the liabilities of the hospital, and it says an important line was, in addition, except for excluded liabilities that are specifically identified, the buyer, which is Mountain States, agrees to assume any and all liabilities of the seller arising from the operation of the hospital through the closing date. Other critical elements: that the line of credit that's extended by Mountain States at closing would be terminated. If something should happen and it doesn't close, that line of credit turns into debt that will be repaid by Unicoi. This is very important. This next section addresses the Attorney General and its payment to the town of Irwin and to the county. And it was called a community contribution. It says, and this is in the document, the community contribution shall be used only for lawful purposes that address the health care needs of the residents of Irwin and the county, respectively, as determined by each of them. In addition, to make sure there's no question, Irwin and the county are each going to be required to sign a receipt and acknowledgement, the form of which will be approved must be approved by Mountain States, where they acknowledge receipt of their respective portions of the community contributions and acknowledge and agree that each shall only use the community contribution for lawful purposes that address the health care needs of the residents of Irwin and the county, respectively, as determined by each of them. So I think this should help to address the Attorney General's issue. With respect to the foundation, the buyer shall contribute to an existing foundation or to a foundation established before closing $1 million for the purpose of serving unmet health care needs related to the needs in Irwin and the county. Prior to Oh, and after the closing and before a hospital is built, Mount States agreed to continue operating the hospital, including surgical services, inpatient acute care services, the emergency room, long-term care beds, home health, until such time as the new hospital is open and operating. Between the time of closing and when it's built, again, Mount States would provide working capital. With respect to the construction of the new acute care hospital, buyer again shall conduct a comprehensive strategic planning initiative involved with to construct the new state-of-the-art inpatient acute care hospital in Irwin. And within 5 years after closing, pursuant to this plan for the new hospital, they must complete construction, open, and commence operation of the new hospital in Irwin to meet the healthcare needs of the residents of Irwin and the county, consistent with the scope of services identified in the acute care plan. The new hospital shall have a minimum of 20 beds or such greater number of beds as might be determined by the acute care plan. And again, pursuant to a return of property agreement and the termination of a loan, and pursuant to provisions that would be placed in the deeds, if the hospital is not constructed and opened or operated by the 5th anniversary, Unicoi shall have a right to require the buyer to convey to the seller the purchased real property and enough assets to operate a hospital to resume operations. Finally, Mount States would also agree to establish a community board with local leaders, and they've done that throughout a number of the different communities that they've operated. And there's another section I know that was critically important to the board, and it says, this was with respect to employment. Mount States, which is the buyer, shall offer employment to all of seller's active employees as of the closing date in positions consistent with those held by them with seller immediately prior to the closing date, and at compensation levels similar to those provided by buyer or Mount States to its employees for those positions. So those are the some critical elements in the documents. Again, with respect to physicians and allied health professionals on staff at the hospital on the closing date will remain on the hospital staff subject to buyer's regular medical staff and board of directors recredentialing process. So again, this is the Mount States proposal is reflected into its letter of intent, then ultimately came to fruition in an asset purchase agreement, and the Wellmont Health Systems proposal would take shape in a letter of intent. And so, Mr. Chairman, that's a summary of the proposals, the implementing documents, a little background of the documents the board, and items the board has taken a look at helping to make its decision.
Thank you very much, John. Moving on, the next item is that the board will now entertain public comments. Such comments will be limited to 3 minutes for each speaker, and the total comment period will be for 1 hour. We have a microphone for the audience. And what we will do, I think people will raise their hand over on this section. Over there. Do we have anyone over there?
61, sorry, Roland. We haven't had anybody file a thing like this in Unicoi County since they closed the United store, I don't think. I think it's great that they are. First off, let me say that this is the decision should be made by Unicoi County people, our board, and the people that are from Unicoi County. And I would like to ask everyone from Unicoi County that is here to please stand, would you? Everybody here from Unicoi County. Everybody from Unicoi County that does not work for Mountain States, would you please sit down? Thank you.
Charles Hanson, I'm a resident of Unicoi in Unicoi County. I have a specific question for the attorney. From what the the Attorney General said, are you working with the attorneys of Unicoi County and Irwin? And does the board, well, I lost my train of thought there for a second. That's my basic question. I understand whatever you all do is really moot until it's approved by the Unicoi County Commission and the Irwin Board of Mayor and Aldermen. Is that your understanding?
Yes, to answer your question, but we are not going to indulge in a question and answer session. So if you have some comments, please make the comments, and we'll move on from there.
Bill Gaines. First off, nobody here wants to lose our local hometown hospital. That's not the intent of anybody. And we wouldn't be in this position if it were not for the failure of this board. Now, when I was the assessor of property for 36 years, it didn't matter if the state of Tennessee came in and reappraised the property or not. The people held me responsible because that happened on my watch. You guys were on the watch when this happened. We wouldn't be here tonight if you had had open meetings. I've been to all of the meetings down there, and the public was not allowed to speak at these meetings. The only meeting we were allowed to speak at was the one that Greg Lynch had. Now, when I refer to this board, let me exempt Sue Jean Wilson, who I think has been very objective in all she's done, and even if she votes the other way tonight, I think she's looked at this thing, very objectively. And we're going to exempt Gary Chandler because he wasn't on the watch when this happened. But we're here tonight because this board failed in its fiduciary responsibility, and that's what's put our hospital in jeopardy. Now let's look at the RFP that was sent out. 4 things on this RFP. It says, assume all current operations for hospital to include the ER, long-term care, and home health. Assume current financial obligations, debt, and all of Irwin's contractual commitments. Construct an acute care hospital with a minimum of 48 beds within 5 years of the agreement. And upon completion and occupation of the new hospital, the old hospital facility will be disposed of in a manner that will return its value to the citizens and taxpayers of Unicoi County. The first proposals that were received by this board were both failures under this RFP. I keep hearing about, well, you should have seen Wellmont's proposal. Well, you should see Mountain State's proposal. It didn't meet the 48 beds. It's only 20 beds. And I want you to notice one thing in this RFP. There is not one single word in here that this hospital has to be built in the town of Irwin. This hospital's been here for 60 years, and the population center of Unicoi County has changed during that 60 years. The sign on the door outside says Unicoi County Memorial Hospital, not the Irwin Hospital. After choir practice the other night, I drove up to Flag Pond. It's 11.5 miles either way from Flag Pond, and it's a little bit less than that from Limestone Cove. But if you go in an ambulance, you can probably get to Walmart faster than you can get to Sandy Bottom from Limestone Cove because of the speed limits. One of the things that I don't want to miss on here, because this is why I'm here.
Bill, your time is up.
No, I'm sorry, no,
It's true. Hey, please, move over here. Anybody over here wants to speak? Right here, Mr. Gill. Please be quiet.
I'm Glenn Tilson, former chair of the hospital board until 30 November. I signed that letter of request for proposal, and I think, as I recall, that it did say to be built in the town of Irwin. As I recall, I haven't read it today, but I believe that's what's in there. This hospital has a long association with Mountain States, and if people have been using this hospital, you saw the number of people that have been been using it. If people had been using it, we wouldn't be in this shape today, having to transfer to this hospital. I have a long-term interest in this hospital. My wife's dad is the one who got it built in 1953. So a lot of people have been either using this one or Mountain States. We've seen those figures. Another thing that I would like to point out is I don't think that Wellmont's first proposal has been made public. I would propose that the press request a copy of that so that the comparisons can be made. I mean, if we want to draw conclusions. I think that the best proposals that I served while I was serving on the board until 30 November, I think the best proposal was Mountain States. Thank you.
Still over here in this center section, Chris. Who's next?
I'm Betty Stevens, and I have moved back to Irwin 17 years ago. I've been associated with the hospital auxiliary for all of those 17 years and have worked as a volunteer at the hospital during that time. I don't think there is a better staff in this whole country than the group at Unicoi County Memorial Hospital. And I feel that a year's worth of work has been done on these proposals. The first proposal submitted was the better proposal, and usually you don't get to go back and revisit these proposals after you've already seen the competition. So I think it's time that we settle this and get on with keeping our hospital here. Thank you.
I'm Jim Long. I'd like to summarize remarks that I wrote to the Attorney General in support of the Mountain States proposal. I'm writing to express my opinion regarding the sale of Unicoi County Memorial Hospital to Mountain States Health Alliance. I strongly support the selection of Mountain States as a successor to Unicoi County Memorial Hospital for the timely execution of the sale. I was born and lived and raised in Irwin and enjoyed a professional career as a corporate executive in multiple locations. I again live in Irwin. My last career position in Irwin was in Irwin as Senior Vice President and General Manager of Nuclear Fuel Services, Irwin's largest employer. I've taken a very active interest in community activities since returning to Irwin in 1987, including Chairman of the Economic Development Board, President of the Chamber of Commerce, and for over 20 years a member of the Monroe Foundation, a 501c3 corporation initiated by NFS to support Unicoi County Memorial Hospital. As the former general manager of the community's largest employer, I'm aware of the strong corporate interest in our local hospital. NFS, with its unique needs relating to its nuclear process employees, has worked cooperatively with Unicoi County Memorial Hospital to train personnel to facilitate unique facility needs. Various exercises are routinely conducted involving safety, security, and emergency medical personnel as a mandatory NRC license requirement. The close proximity of our community hospital to our industries and nursing facilities cannot be overstated in its value. In industrial recruitment, particularly important to Irwin, and the two major industries have closed in the past several years, our ability to recruit is greatly enhanced by the presence in Irwin of good schools and a good hospital. Mountain States can adequately meet our local needs. I strongly support the construction of a replacement and upgraded hospital facility within the town of Irwin. In addition to the reasons stated above, Irwin is central in Unicoi County, both geographically and population-wise. In reconstructing Irwin's medical facilities to meet the local needs rather than to reinvent itself as a local competitor of Mountain States, I feel the plans of Wellmont are rather self-serving rather than community-oriented. I've visited 3 satellite hospitals within Mountain States system, from large to small, in both metropolitan and rural settings. The work performed and the facilities constructed by Mountain States in these communities are what Irwin and Unicoi County needs. The Unicoi County Memorial Hospital was founded in Irwin in the early 50s by Irwin doctors, who each donated their services to the indigent at no cost. And by the way, the rooms were donated at only $10 a day. Just to make the hospital a reality, both the town of Irwin.
Your time is
and
up,
County.
Jim.
Thank you.
Thank you.
My name is David Bird. Most of you know me. I don't think anyone doubts that we've got a crisis on our hands. All the facts and figures are there. What this comes down to and what people want, what you want, is affordable health care. This board, the ones doing the voting, need to look at the track records of these two entities. Several weeks ago, an article in the Johnson City Press brought out a simple procedure, pneumonia, I believe it was, where the cost for one of these organizations was over 4 times the average. Okay? I've got insurance. Unfortunately, some insurance companies are not recognizing Mountain State. Therefore, if you happen to be like me and have sickness, you have 2 choices. Pay more because of their cost structure, or go to one of the other area hospitals that do take your insurance. To my knowledge, Wellmont accepts all. Cigna has no problem with them. In fact, Blue Cross Blue Shield of Tennessee, which is one of the largest companies in Tennessee, has had difficulties with Mountain States just recently. Oh, we reached a decision this year. Folks, you folks with Blue Cross Blue Shield, what's it going to be for next year? I can tell you what it'll be for Wellmont, business as usual. The reason that I was told that Cigna and Mountain States could not reach an agreement is that Mountain States refused to lower their rates to fair and reasonable cost with other surrounding hospitals. Okay? The choice is yours. It really is. I personally would like to see a referendum. I think that this is such an important part of this county at this point in time. Not just now, but the future growth of this county. If you ever intend to have a new business or a new organization show up in this county, and we've all wanted it, one of the first things they look for is what's the health care and how much is it going to cost my employees? Can we logically put in an organization that charges more? I don't see how you can reach that decision. I really don't. Not with a clear conscience.
Sir, your time's up. Thank you.
Hey, I'm Roseanne Aldrich from Irwin, and I've been in healthcare for a long time. I've worked for many years for Mountain States. I've worked closely with Wellmont. I would like to comment on your comment about the insurances. I promise you, contract negotiations with the insurance companies are ongoing all the time. And entities like Mountain States, Wellmont, Blue Cross and Blue Shield, they're going to come to an agreement. They get on the news, they send out those letters of scare tactics to give the community all uproar over losing or the hospital not accepting your insurance. But they will not let those contracts dissolve. There's a lot of rumor going on around the community about, and you may choose not to address this, and that's okay. I'm not here to go one side or the other. But there's a lot of rumor in the community now that some hospital board members are having some kind of a personal gain, in essence of, I don't know that the term is buying votes, but it's been alluded to that. That there's been promises made to board members to sit on the Mountain States board, or there's been some personal monetary gain for you. And I would like for the board to address those rumors. I'm not saying either it's true, it's not true or anything, but I would like to hear from the board members about those rumors and if any kind of promises have been made to you to vote one way or the other. Thank you.
My name is, I'm sorry. Okay. My name is John Day, and I'm from Irwin, and I'm not here as an advocate for either healthcare provider. I am here as an advocate for everybody sitting out here and myself. Because to use a little bit of Mr. Gaines, set the stage, if there's anybody here that doesn't want to say so on all this, then you're all here because you want to say so. And I promise that David and Bert and I did not collaborate on this before the meeting. This past week, I've done some research, some discussions with attorneys, Sarah Bailey, at the Election Commission. And there is a possibility for a referendum here. That would put this on a vote. That would give everybody in this room, everybody in the county, a chance to vote. Charter that a referendum is allowed on the sale. It's not there. So these folks here have to amend the charter, put it in the charter that a referendum will be allowed. That's easy. I've taken the liberty to draft a petition for everybody in the county. It's split it up a bit, but it can't go out tonight. They have to change it. Once they change it, if they change it, then you can take the petition and it has to be certified to the Election Commission. You can distribute the petition. It's going to take 200 to 300 signatures to get it on a referendum for a special election in the fall, which is going to cost the county some money. But I would say, how about the two health providers splitting the cost on that election, get it done, or it can go to next May on the primary elections, and it won't cost us a lot of money. So that's what I'm saying. There's problems either way. We've got finances to, financial issues going that long. But it is possible, and I just wanted to throw that out to everybody and to the folks up here. The referendum is not out of the question. Okay. Thank you very much.
Good evening. My name is Patty Gentry, and I am the nursing home administrator. One thing that I believe that has gotten lost in this whole conversation, we are worried and concerned about quality health care in the hospital for this county. But the other thing is the residents that live in long-term care. On an approximate day, there's 44 people there that I am responsible for and that my staff is responsible for, and we love and care for them on a daily basis. They need a home. I have several residents that watch the TV, read the newspaper, and will ask me, do I still have a home? We need to come to a conclusion on this, one way or the other. Mountain States Health Alliance has been supportive of us since day one. They came to me, Patty, what do you need to help support your residents? And I can honestly stand here and say tonight, there has not been one thing that I have asked for that they have not supplied. And I have no doubt that they will continue to supply the needs for those residents. We need to understand that if the hospital does close, the referendum that you just mentioned, if it goes that far, who is going to come and help? Ma'am, you're going to have to go find somewhere else to live. Who's going to do that? I don't want to be the one to have to do that, and I don't believe anyone else in this room wants to have to do that either. A decision needs to be made, and it needs to be made quickly. And I support Mountain States Health Alliance. I'm not embarrassed or ashamed to admit that. They have committed to us, and I believe they will follow through. And thank you.
Hello everyone, my name is Bruce Herbertson. Good many of you know me. I have one word to say. It's monopoly. From Kentucky on down, Mountain States has roughly 19 facilities. If they acquire the hospital here in Irwin, that'll make it almost a total monopoly. My doctor's office is 30 miles away. I have to go to Kingsport because I have a doctor's office that only is associated with Wellmont. And I think a monopoly is not in the best interest of this county, and that's all I've got to say.
Hello, I'm Carol Monroe Tilson, and it was mentioned that my father was very instrumental in getting our hospital established. One of our previous speakers also suggested that perhaps some of the board members were being promised favors, or that there were monetary gains to be made. And I have heard rumors. People think that the Monroe Foundation is a family foundation. I would like for you to know that it is a 501c3 organization. It is governed by the IRS. My board members are non-compensated. They do not receive pay of any sort. I do not receive pay. If the foundation ever ceases to exist, any funds that remain must be distributed to another 501c3 corporation. None of the funds can be dispersed to individuals. Our purpose has been to educate people in Unicoi County. Starting in 2001, we started a scholarship program. Since that time, we have awarded 18 scholarships to Unicoi County High School students. The board members do not receive any compensation. We have not even been to the Peerless for dinner. We receive no benefits other than the knowledge that we are helping educate Unicoi County students who wish to go into a healthcare related field of study. The foundation has not been approached about receiving that $1 million. Another thing you need to keep in mind, there is a separate hospital foundation already in existence. I would like for you to know that my family will receive no benefit. Thank you very much.
My name is Jennifer Hebner, and I'm an employee at the hospital. And I don't think that everybody saw when G said 5 days. We could survive 5 days. So a referendum would be great, but that should have happened last year. Okay? We've been working with a computer system that is less than effective to do the job that needs to be done. We are stressed out to the max. We are worried about our long-term care residents. The amount of support that Mountain States has shown us already has been great. 5 days, people, and we're gone.
is Flora Shelton. My question has nothing to do with me working at the med center, but my question is to the community. Apparently by the graphs you all seen, they've already chose to go to the hospitals they didn't drive to Wellmont. If this doesn't go through and Wellmont wants to get the hospital on the north end of the county or wherever, I'm assuming the tax bases would be higher. I don't know for whoever gets the hospital. But do you all want to drive to Wellmont to get your medical care? Or do you want to change doctors? If you have a healthcare system that you had been going to anyway, and then all of a sudden you don't, you will be changing doctors. So I'm talking about patient interest here. What's best for the patient?
Yes, my name is Jim Wilson, and referring back to Mr. Gaines here, I've county commissioner, been one for 7 years here in this county, and he's blaming this board for the failure of our hospital. Let me tell you something. The failure of Unicoi County goes back to our tax assessors, now and previous, because we get the blame for everything the county court does. We do not set a tax rate, the tax assessors does. He's throwing the blame on you all for the failure of this hospital, so I'm pointing back to the courthouse, to the tax assessors.
Not related.
Hi, good evening. My name is Mike Penner. I'm an outsider. I've only lived in Unicoi for 20 years. I just want to stand up and say that regardless of what eventually happens, this community has an incredible staff at that little hospital. A couple of years ago, I'm deathly allergic to yellow jacket stings. I got into a yellow jacket's nest while trying to help out a member of our community. By the time I got to the hospital, I could barely see because there was no one to take me. When I finally got in the ER door, I was met by not only one person, but 4 or 5 more. You would have thought I was the only person in that hospital. There had to be a half a dozen people in the room. And I'd just like to say thank you to the Unicoi County Hospital and staff for probably saving my life that morning. You've got some great people. The only thing I'm concerned about is we keep hearing about the planning task force from Wellmont, planning task force. That a little concerns me. That seems to sound like we have to adopt the bill in order to find out what's in it. I'm just a little concerned about details. But again, your decision is going to be yours. I don't have a voice in that, but you have a wonderful hospital and a terrific staff. And I hope you recognize how blessed you are to have the people at that little hospital you have. They are something special.
Good evening. My name is Michael Swim. I am Director of Radiology and Dietary Services. I've been associated with Unicoi County Hospital for 26 years. It's almost half of its existence. And during that time, I can tell you factually that Mountain States, long before it ever became Mountain States Health Alliance, Johnson City Medical Center has supported our facility, specifically supported radiology for supplies that we didn't have. Let us in returning back to them equipment that they had replaced that was like brand new equipment to us. Throughout our facility, that can be documented. That is factual. This is an emotionally charged situation here. As employees, we have worked at our hospital for many years without pay increases. Why? Because it becomes home after we've been there so many years. I know many of the people in the community that I have seen, met, know their family. I asked this group of people, Wellmont Health Alliance is a good facility. Mountain State is a great facility, health-wise. But I ask you, who has helped and assisted Unicoi County Memorial Hospital? Mountain State health-wise. That is factual. Patient care. Where do our patients go? The continuum of care. They come to our facility. If we cannot continue the care that they need, they're transferred to a Mountain States facility, being Johnson City Community Hospital or Medical Center at one time, Memorial Hospital at one time. Physicians that support us have supported us through the years. We have a radiology group that has staffed our hospital since the day it opened, 60 years. They're still there. They're still serving the community of Unicoi County. Thank you.
My name is Alicia Lane. I'm the Director of Nursing and Long-Term Care. I just wanted to reinforce some of the things that Patty has said. We have residents who are scared to death. They don't know what they're going to do. They don't know where they're going. We also have staff there. They don't know what they're going to do. Wellmont has not said that they will keep long-term care. Can we afford not to have it? We have 50-plus employees that are direct care people. So they work there. 50 employees. Can we afford to lose 50 employees in this community? Can we afford to lose those jobs? That doesn't include the ancillary people, the housekeepers, the people who work in the kitchen. That doesn't include the maintenance people. Can we afford not to have those people if Mountain States doesn't take over? And all the things that they say about Mountain States helping us, long-term care couldn't function today if Mountain States hadn't helped us. If they hadn't been there for us, helped us with some things, we wouldn't have Mountain States here. I don't work for Mountain States. I work for Unicoi County Memorial Hospital. I don't really care one way or the other. I work for this hospital here. I care about these people. I care about this community. This is what I have seen. This is what I have dealt with every single day for the last year and 9 months that I have worked here. I have lived in Irwin for 15 years. I have worked in Irwin for 12. We need to get this taken care of. We need to make sure our people are taken care of. 46 people live in this community, live in this long-term care. 50 people plus work there. Can we lose those? Can we afford to do that? I don't think we can.
My name is Chris Turner. I'm a citizen here of Unicoi County. I've heard several arguments here for both sides, and the only thing that I have to say is I am one person. I myself can't really change anything. But we here as a community have a voice that we need to exercise to let these people know how we feel. Everybody on this board, except for 2 people, tried to take that away from us. They violated the Open Meetings Act. They held meetings where the public was not allowed to speak before, and they tried to make a decision without us. That, to me, that shows me 2 things. One, they don't care about our opinion, wants, or needs. And 2, they have something to hide. Do not let them do this to us. Put it to a vote. Let the people decide. It's for us anyway. They are supposed to work for us, not themselves. That's all I have to say.
Hello, I'm Dr. Ken Trizzle. I work at Unicoi County Emergency Room. And I'd like to address a couple of things that have been said. First of all, I'd like to strongly encourage the board to adopt the Mountain State's proposal. Various reasons. First of all, this gentleman brought up the idea of prompt care, quick care. We provide that, not only for bee stings and anaphylaxis, for MIs. You may chuckle, but we average around 60 minutes door-to-balloon time for acute MIs. So if you want a heart attack, if you have a heart attack, we can make better statistics than most hospitals. Latest article, Journal of Emergency Medicine, that statistic has reached only 51% of the time in the country. That's our average. That comes from working with Mountain State. Long before this was ever a situation, I have met with Mountain State's personnel since 2006, the door-to-balloon initiative. How can we increase what we do for the patients? There's no money. They're not paid to come down here to talk to us how to provide better care. They have done it because they want better care. And it's just not with MIs. It's with strokes. It's with trauma. I can get a traumatologist on the phone in your care within 30 minutes. I can't do that when I work in Knoxville. They have gone out of their way to help us, even in this time frame now. Somebody mentioned that they asked us what we needed. Before there was a proposal, Mountain State's personnel came to the emergency room, said, what do we need to provide better care? And they structured their proposal. I have not seen one Wellmont person, period, not ask anything, not on the phone, picking up and say, what do you need to provide better care? Mountain State has been here. I work at Unicoi County. I'll work with whoever, but these people have gone out of their way to provide good care for these people. And I think this is a proposal that we need to adopt here. In closing, I would say to the board, why change what works? We get our patients good care. Their specialists are in Johnson City. We do it in a timely fashion. If we try and increase the distance going to Kingsport, it's going to present a significant burden to try and get the same timely care. We're not going to get the statistics of 60 minutes door-to-balloon time going to Wellmont. Wellmont's a great facility, but distance prevents it. I strongly encourage the board to adopt the Mountain State's proposal. It's the best for this hospital to provide care for our patients.
My name is Ray Edwards, and I've been to all three hospitals. And I've been to Irwin, and they've been outstanding. When I come to the emergency room, I either say I want to go stay here at Irwin, or either go to Wellmont. And I've been treated nicely here. But I had back in, I think it was 2003, I had a stroke. And they come here. They sent me to Mountain State. Well, I got there. They gave me a shot. I found out I had a stroke. Well, they gave me a shot. They put me in I call it a pig pen. And I stayed there for 24 hours. He said they didn't have a room. When I get to the room, I was telling the orderly about it. And he said, there was a room here. They didn't put me up there. So when I come back here again, I told them no way would I go back to Mountain State. I'll have a wife to drive me to Kingsport, Wellmont. From now on, I'd never go back to that. The way they treated me, I was up there once with a cold, and I had to stay 8 days because of stag disease. They got plenty of it up there. And I think I've said it all along. This should be decided put it up for a vote for the county of Unicoi, not the town of Johnson City or any other place. It should be decided. It belongs to us, so we should vote on this, not let the board do it, because the board has let us get out of line. They should have known about this sometime. So I think it should come up as a vote and let the people of Unicoi County decide on what's going on. Now I'm telling you, there's a few on the board I trust, but there's some I don't trust. So that's about all I know.
Hi, I'm Marie Shelton Rice. I was born in Unicoi County Memorial Hospital. I've made several trips back there over the years. I'm a resident of Flag Pond. I personally want to keep our hospital in the town of Irwin because it's closer for me and my family, my friends, my neighbors, and their families to travel. The first time that we heard about Wellmont, Bart Ray got one of the spokespersons at Flag Pond School. And the first question that we asked her was, are you going to build a new hospital in Irwin? She couldn't answer that question. At first we thought this might be good for competition, but they weren't interested in building a hospital in Irwin, so we lost our interest in Wellmont. We read the first proposal from Mountain States, which was made public, and thought that Wellmont would make a better one. But we've never seen the first proposal. They've never made it public. After some political wrangling, the hospital board opened up bids again, and Wellmont's proposal still wasn't as good as Mountain States. And they still weren't, their proposal still wasn't as good as Mountain States, and they still weren't interested in building a hospital in the town of Irwin. So I can't understand how anyone could think that Wellmont's made the best offer. Have you read all the proposals? Oh, wait a minute. That first one that Wellmont submitted that we've never seen, it's never been made public. Why does Wellmont want to hide that first proposal? I thought they were the ones that wanted this to be a transparent process. I think we should demand that Wellmont make the first offer public so we can see exactly what the Unicoi County Memorial Hospital Board members had to vote on the first time. Unicoi County Memorial Hospital has saved countless lives in the 60 years that it's been in the town of Irwin, and it needs to remain in Irwin. Our families helped build this hospital. Our families have been born here. Our families have died here. We need to keep our hometown hospital right here in Irwin. I have a personal interest in our hometown hospital. My grandfather, Roy Shelton, was a county commissioner when this long-term unit was voted on and built. He lived his last days in the long-term after Alzheimer's took over. I'm sure if he was here today, he'd say we need to keep this hospital in Irwin. There's approximately 18,000 more reasons for us to keep this hospital centrally located in Irwin. So let's pull together for the benefit of everybody, from Unicoi to Flag Pond, and let's put this hospital right here in Irwin where it needs to be.
My name is Candy Casey, and I've lived in Irwin for 40 years. And I just want to make one comment, and that basically is, if Johnson City Medical Center is already where they're at, and we have Wellmont in Unicoi County, then we would have a choice which hospital to go to. When you have competition like that, your prices stay down and your services will do better. If it stays the way it is, and Mountain States takes care of everybody, then good luck, because they don't have to try, and they can up their prices as much as they want. Thank you.
Hello, my name is Laura Crow. Whichever entity does obtain our hospital, and I've said this in the past, utilize the services and the things that they're going to provide to us in our county. When they bring in these physicians, radiology, whatever, people use our hospital in Unicoi County. Don't be going to Johnson City. Don't be going to Kingsport. Because I promise you, whichever one it is, our numbers do not go up, prices don't come up, we don't make a profit, our hospital will still close, regardless of which one that it is.
Hi, I'm Pat Staley, and I've been an employee in the Unicoi County Memorial Hospital for 32 years. And I can say that this is one of the most challenging and stressful situations for the employees of Unicoi County. I need to address something that was said about the charges, versus Mountain State charges versus Wellmont charges. I work in reimbursement. I'm in revenue cycle. And I can tell you now, it does not matter what someone charges for pneumonia, because you're going to be paid on a DRG most likely. You're going to get the dollar amount. It does not matter. And I know in working in reimbursement that you're either going to be paid a fee schedule, you're going to be paid an APC, you're going to be paid through DRG or an ambulatory fee schedule. And I can vouch for that and say that with all my heart. And my heart's desire is that we get this resolved so we will have a hospital in Unicoi County.
My name's Terry Williams. One of my concerns is, when business is doing something, I've never heard Irwin advertise to get more patients in, and I love Irwin. I love the hospital here. But when business is run like a business, people wouldn't be running to Johnson City. We need to have something to pull the patients back in here. And when we, like I say, monopolizing business, it's bad. It can run prices up according to business. And all the studies that's ever done. So I support whatever would be good to Unicoi County. I know it wouldn't take that much longer to run Unicoi. And if it's built out here, it's on a floodplain, what are we going to do about that? So we'd end up building up the soil high enough to keep it from flooding. So that's questions I have, There's concerns either way we go about it.
Mick Bergendahl. I do live in Irwin and Unicoi County. I supported the board's decision when they chose Mountain State to start with. It looked to me like it was down to a business decision, which I thought it should have been. One proposal said this, the other proposal said this, and the best one should be chosen. I thought that was the board's decision, and I would stand and support them then. as far as being a resident of Unicoi County. I was born here. Russell and I were at the old hospital. So we're not 60 years in this thing. We've been here a long time. And I do appreciate the effort that the board and those folks that are supporting the either side have put this thing. I do not appreciate bringing the emotional issues and staying away from the facts, which have still often been out there.
My name is Star, and I would like to say that first, I am not for healthcare for profit, never was, and never will be. And I would like to ask the people of Unicoi County, whether you're from Mountain States or Wellmont, do you know who owns these companies? Do you? Do you know if it's a single person who's from the Tri-City area? Do you know if it's people from the state? Do you know if it's people from the country? Are you going to be prepared for changes that might happen in the future because of the ownership? I think it's something that everybody needs to think about. I was very much for keeping your county hospital. I think the board should have started this process back in 2008 when they started seeing the hospital being the red. I know that we have county hospitals who have banded together and formed a cooperative. They did this for the reason to have buying power, so that they would get things cheaper. And to keep the county hospital in the people's hands. So, I think it's something that you need to think about for the future, for your children. Where are the policies going to come from? And I'm not really a big speaker, but I think these are important issues to ask people from Mountain State and to ask people from Wellmont. Thank you.
I was tempted not to speak tonight. I spoke at one of the previous meetings, and first of all, I'm James Bird. I was born here in Unicoi County, worked and trained in Memphis, New York, Florida, a couple other hospitals, and I'm now back home. I brought my mother in with a broken leg, I don't know, a couple of years ago now, and I was astonished to find out the hospitalists wouldn't admit her at Unicoi County Memorial Hospital. We literally had to beg for your hospital to care for her. Now, so I started looking around. I started asking some of the staff, is this common? I mean, is this something that happens routinely? And I was told by almost every staff member, yes, that there are people turned away and sent to the medical center routinely. And that's understandable. Maybe a cardiac issue, maybe neuro, maybe something that the hospital doesn't care for as far as having the staff and the ability to do that. So I started looking at the financial records of the hospital around that same time. And the hospital had been going downhill for a while, financially. I think we learned tonight it was losing about $250,000 a year. My mother ended up being able to stay there at the hospital after some negotiating, you may say. We wanted her to stay there. She was comfortable there. She was from Unicoi County. I think the hospital was billed and probably, she has a couple different insurances, probably gained about $20,000 from that admission. So $20,000. She was one person. So if two people were turned away a month, that's $40,000 a month, $480,000 a year. You were only upside down $250,000. That's just one or two patients a month that the staff here will back me up. that have been transferred or sent to the medical center, what I would call unnecessarily. Now, some of the board members may deny that or say they don't have knowledge of that, and they may not, and that's their fault. I think the hospital, people of Unicoi County, are lucky we have Mountain States, lucky we have Wellmont, that have interest in this hospital. We're very lucky, considering where the hospital stands right now. And the fact that there are two people bidding against each other, basically, is another benefit for the people of the county and the hospital, and we're very lucky to have that as well. So I'm not here to point fingers. We can't go back in time. But there are things that could have been changed years ago to allow more people into the hospital. The only reason you only have a 40% market share of the population is because when they show up at the ER and they're automatically sent to the medical center, they're not going to come back to the ER. They're just going to go to the medical center. You can't blame them. Why would you have an ambulance charge to the ER here in Irwin and then one to the medical center? Thank you guys for your time. I appreciate it.
My name is John Morana. I've lived here for 25 years, and I want to first corroborate a lot of what other people are saying. Thank you to the board for making a good decision the first time around, in my opinion. I think it should be kept as a business decision. It's hard to make decisions based on emotions. I'm hearing a lot of people over here that are in support of Wellmont that don't understand the difference between gross revenue and net revenue. People that don't understand, as this lady over here that works for Unicoi County, how hospitals are paid no matter who they are. You can be a monopoly and raise the prices all you want. You're only going to get what the insurance companies pay you. My stepfather is a CEO for a group of hospitals in the Charlotte area, and what Unicoi County has been suffering is a nationwide epidemic. Private, small, community-owned hospitals are all having to make changes. It's not a matter of a board making bad decisions. It's not necessarily a relationship between tax revenue. It is a national trend. We have huge, huge changes. And I want to thank you for making a very difficult decision. And I think having made the right decision last time. Thank you.
Our public comment period, on behalf of the Board of Controls, I'd like to thank each of you for making your feelings known. I appreciate your input.
Can't hear you.
I don't have a mic, sir.
Well, speak up.
I said we understand that the citizens of the county feel passionate about the health care, the hospital, and their community. Again, thank you. And now at this time, it is time to move into our next issue, and it's for the board review, discussion, and selection of the proposal. We need some discussion first. We need some discussion first.
My name is Frank Wakeman. I'm the hospitalist at Unicoi County Hospital. I've been there since April 2004, and it's been my pleasure and my honor to take with that. Some more items for disclosure. I'm a private practice physician. I'm an independent contractor at Unicoi, but I'm not an employee there. And this is my 6th year as the chief of staff. I've tried to retire several times, but it hasn't worked. The chief of staff sits on the board and functions as a representative of the medical staff, and that's why I want to share some facts and figures with medical staff. With the board, basically originates from the medical staff. I've been a resident here. I've been a resident of Unicoi County since 2001,
and I currently live in Irwin with my wife and children. There have been a lot of changes that we talked about, and GP did an excellent presentation about the changes that are being imposed upon us. And the mantra is we have to change or we're going to close. That's the bottom line, and that's the decision that's in front of the board tonight. My research shows that disappearance of independent hospitals in Tennessee and East Tennessee, 45% in the last 10 years, and that number includes large major hospitals like Vanderbilt. So small community hospitals are almost extinct at this point, and we're going to go that way unless we make a decision to partner with somebody. Some of my research shows that up to 20-30% of hospitals will close within the next 10 years under the Accountable Care Act. And so there's a big need for this board to make a decision to partner with the large companies so that we can ensure a long-term survival. Several patient care issues that I think need to be discussed. I did an internal poll of our medical staff, and 90% of the medical staff is in favor of the Mountain States transition. And we looked at the last 2 years of data as far as transfers out of the ER. 98% of those transfers that somebody else had mentioned went to Mountain States. So we have a long established relationship and multiple pathways and organizational things that have been done in that way. So making a change would, I believe, would compromise patient care at this point. 93% of hospitalizations from Unicoi County are at Mountain States or at Unicoi County Hospital. And currently, and the majority of subspecialty care is provided in Mountain States. So a transition to another healthcare system would require an entirely different set of subspecialists. So that's another item that I think the board and the community needs to consider. One statistic that I looked at was we have an elderly population. 16.4 of our population, 64% of our population is over 65. And my discussion with most of the elderly patients is they have no interest in even driving in Johnson City, so I can't imagine them trying to go to Kingsport or Bristol. I think that would present a hardship for them, and I think that help us make a decision about what the best option is. Currently, also, we have contracted services of radiology, emergency room, pathology, and referral lab sources that are made with physicians group that are privileged at Johnson City Medical Center right now. So I think if we made a transition away from those groups, there would be a transition period that would create tremendous jeopardy again for our patients. And I think that would be ill-advised at this point. Dr. Criswell had mentioned that transport time is very important, and in healthcare, time is very important. And another gentleman talked about BCing, and that's something that's very important, that a facility be located centrally in a county or a community for emergencies, something like that. Minutes, seconds make a big difference. And Dr. Criswell had also alluded to AMI care. A delay in transport time could be catastrophic. And so that's another item I think that we need to consider. I took the liberty to basically look at some of the transport times. Ground transport time of emergency from the ER in Johnson City, at Unicoi County Hospital to Johnson City Medical Center is about 20 minutes. That's for ground transport. Flight transport is 5 minutes and 15 seconds. Transport to Bristol Regional, approximately 60 minutes, and Holston Valley is for 45 minutes. So either double or triple your transport time for definitive care, which I think would be result in excessive morbidity and mortality for our communities. One thing that really impressed me about as the board was going through due diligence to try to decide which system would be the best for the community is that as we look at the Accountable Care Act, a large percentage of hospitals are going to be challenged. They're going to either close or they're going to force a merger. And as I discussed the future of healthcare with multiple CEOs of hospitals, Todd Love and I have spent several afternoons going talking to other CEOs, and basically the bottom line is that only the strongest healthcare systems are going to survive in the next 10 years. And so we need to feel like we need to align ourselves with the healthcare system that's going to survive long term. And it's a very simple decision. It's basically based on revenue and number of patients served and size, and that's pretty much who's going to survive the next. I don't think the general public understands exactly what's going to transform in the next 10 years as far as healthcare is concerned. So we're going to see a lot of changes, and I think that we ought to consider that carefully as far as our future decisions, as far as what we can do. So again, it's been my privilege to serve here. I get a bit emotional about my work, obviously. But again, I feel like I have the interest of the hospital in mind. When we're trying to make this decision, I feel like the obvious decision is Mountain States at this point. Thank you.
Thank you, Doctor. We appreciate that. I know he has a lot of emotion and a lot of time and effort and energy invested in this hospital. Thank you very, very much.
Yes, I'm Todd Love, member of the board, and lived here all my life. Is it on? Okay. As Dr. Wellmont said, we both, well, the whole board did their due diligence. I visited at least 5 facilities, 2 of Wellmont's and actually 4 of Mountain States. Actually went to one yesterday. To do your due diligence, you have to do that, and I was impressed. In all the facilities, Wellmont as well as Mountain States. In my decision, I feel like that one morning I got up this week and I measured the distance in all the schools to where the proposed site of Mountain State's building. The furthest actually is Unicoi, but the other, which I would predict would be 90% of our students, one is 3.9 miles, one is 3.1. The ones that we're setting in are around 2.4. So approximately 90% of our students are going to be within a 4-mile radius of the new facility. And again, I looked at the industrial part. Probably around 90% of our workforce is going to be within 3 miles of the new facility. And in my opinion, that has a lot to do with this. That's where the people are, that's where we're working, that's where our students will be. And it's centrally located for our whole county. And as it's been brought up, Mountain States has been a part of Unicoi County Memorial Hospital for years. And it would be reinventing the wheel. And I appreciate your all attendance. And if anyone else has anything to say, please be open.
I'm Gary Chandler. I'm new on the board, but I've got a few comments I'd like to make. I have no conflict of interest, nothing to gain, no political gain at all. And like Todd said, the proposed location of Mountain States is in the center of the 3 districts. Irwin has got a population of 6,097. That's over a third of the population. And like he said, it's close to all the schools, the industry, the railroad. This is, to me, the prime location. It's been surveyed, and it is out of the floodplain. And I just think, like Mountain State said they'd build in Irwin, Wellmont said they'd be building the northern portion of the county. Well, there goes your hometown hospital. Thank you.
I'm Sue Jean Wilson, and as a county commissioner and alderman for the town of Irwin, I would like for the attorneys to explain to me one more time why this meeting is being held and a vote to be taken to sell a piece of property, a business, when we have yet to be to the town of Irwin and to the county to get the permission to do so.
I'll address that. Number one, the Attorney General has given us feedback that's the way he wants it. And that's probably the most important reason. Number two, if you view nothing in the Articles of Incorporation requires a vote on the sale of assets. What the Attorney General did, respectfully, is analogize the sale of assets to a dissolution. And the analogy is that the town and the county, as the incorporators, they aren't members. The town and the county are not members of Unicoi County Memorial Hospital, Inc. They formed the organization years ago and delegated the authority to the board of directors. They constructed a decision-making apparatus in which the town and the county would be balanced, in which the chief of staff would be stuck in the middle. But number one, the Attorney General in the feedback has said he wants it that way. Number two, again, if you analogize this to a corporation, the board of directors of the board of control knows the hospital best and makes a decision and then recommends it to its owners. And that's how, and the owners or incorporators would be the town and the county. For example, if you were if it was a company out there and the board of directors came up with an idea, the board of directors, if it was important enough, would submit it to its shareholders. The shareholders don't get to vote initially on the proposal. What they do is they vote for the board. And that's really what's happened here is the town and the county appoint their board members. The board members help set policy for the hospital and vote on the decisions. And in this case, this decision, pursuant to what the Attorney General requires, will be submitted to the town and the county. If the town and the county voted first, they could be giving direction, but they would work through their board appointees to get the policy done. So one, I guess, Eugene, is the sort of structural, and one is really advice to the Attorney General. The Attorney General admitted, I believe, that they struggled with that issue. And then, respectfully, as an attorney who's trying to dot I's and cross T's, we didn't, it wasn't set forth in there, we sought some more advice. And they wanted the proposed transaction to be set forth. So I hope that's responsive.
Thank you, Mr. Chairman. I got a little ahead of myself a few minutes ago. I'd like to add a little bit to what Dr. Wegman and Todd Love over here stated so eloquently. There's a variety of reasons which I support Mountain State's Health Alliance, and one of the major reasons was one that I addressed to the Attorney General, among others. It is that everything, as Todd pointed out and Dr. Wegman pointed out, is centrally located in Unicoi County. That's where all of most of our state government, our federal government, our local offices are. That's where the Unicoi County Courthouse is located. That's where the majority of the school systems are located. That's where approximately 90% of our industries are located. And I had a map when we went down and addressed the Attorney General showing, I think approximately the length of the county from north to south is approximately 28 miles. And starting at the North Carolina line, up there, almost 28 miles to the Washington County line. And to put, as Wellmont stated, in the northern end of the county, and Ms. Denny DeNarva so stated to the board that she wanted it as close to the Washington County line as possible. That would put that, unless there's a house or two that I've missed out there, beyond 100% of the population of the United States, or excuse me, Unicoi County. Sorry about that, Unicoi County. It would just be a terrible situation, as one of my colleagues over here on the board pointed out. A third of the population is in the town of Orland. Approximately a third of it is in the first district. And approximately 1/3 is in the 3rd district. However, within the town limits of Irwin, probably another 15 or 20% within a few miles of that. So I think it would be a bad situation to have a hospital, and Wellmont is so stated they want to put it as close to the Washington County line as possible. And also they stated in their proposal is that they want to serve, this is the words in the proposal, they want to serve Carter County and Washington County. And that's the only reason they would accommodate a 48-bed hospital. Our daily census of the hospital in Unicoi County recently has been 12 and 14 per day. There's no way that Unicoi County can support a 48-bed hospital. So if it went out there in the northern end of it, it would be to accommodate Washington County and Carter County. So.
The one that does me, I'm Jimmy Irwin. Been on the Board of Control here for about 4 years. Previous to that, I served as a county commissioner for the 1st District of Unicoi County for about 8 years. And been a volunteer in emergency services for about 25 years. And of those 25 years, I've dealt with a lot of hospitals across the state of Tennessee, transporting patients. Here in East Tennessee, Wellmont, Mountain States. They all provide a good service to the residents, what they cover. Our community hospital, as someone stated earlier, we have, since we come on the board, have done so many advertisements, been to so many public events, trying to bring more people into our hospital so that we can treat them, so we can run the tests, do blood work, whatever we could to make money for our hospital. It hasn't worked. That's why we're here today. With healthcare reform, the cut on rebates, we're not getting the money back that we used to. The last couple of years, this hospital has barely made it to the point where when the board came up with the decision last year, hey, we've got to start looking for partners. I remember attending a conference when I first come on this board 4 years ago. Someone that was supposed to be a specialist in the field, I remember who he was, where he's from, I think Florida somewhere, said, if you do not team up with a big brother, you will fall. That's what it's coming up to. We've got to team up with a big brother to make sure that we continue to have a hospital here in Unicoi County. If we want to have our own hospital and continue to have a hospital like our hospital started 60 years ago to provide health care for Unicoi County, and our choice at this time, we need to stick with Mountain States because they have come in and helped us before we even asked for help. And that's going to be a good decision, I think. It'll be best for what we need if we can.
Thank you very much, Jimmy. I've sat here and everyone has talked, and I came in with a page and a half of information. And as I listened to our attorneys, one of the board members talk, I checked off every one I've had. There's one item that I would like to talk about that I think is extremely important. And that is we have 230 plus employees here at this hospital. And we cannot delay the decision on this hospital. We are out of money. We just got another $1 million that have been allotted to us from State Health Alliance. There's no time for any referendums. There's no time for delay. Now is the time. And, you know, there's a lot of dissension out there. There's a lot of people got different ideas and all of that. But this board is here tonight, and we have to make that decision. We can't shirk our responsibility. We can't run and hide. It's going to make some people happy. It's going to make some people mad. But, you know, so be it. We got the responsibility. We have the accountability. And that's why we're here. Not only did Gary get appointed to this board on July the 8th, but I also got appointed onto this board on July the 8th. I am starting my 34th year on this board. Sometimes I wonder why I put myself through this, but this is for our community. I was taught you've got to serve your community. You've got to do the things that other people may shirk from or whatever. But if you're going to have a community, the one thing you've got to have in that community is a hospital. Now, we can fight and fuss among ourselves, but look, it's time to come together. It is time for a decision, and it is time for everyone to talk to your board of mayor and all, talk to them nice, talk to them pleasant, be respectful, and be delicate, because they're, you know, it's a difficult decision. But we've got to have the city, in addition to the county, we've got to have that too, because we've got to have togetherness when this goes in to the Attorney General. And so that's the key thing. Okay? There's a lot of things, as I said, that people may want and may talk about, but again, buck stops here. It's got to stop here tonight. And as I said, those 230 employees that we're responsible for here, whose livelihood depends on this hospital. One of the big reasons I was searching through here for something to look at and to talk about after most of my comments were already been talked about, was that Mountain State Health Alliance, they took our employees unconditionally. They didn't say we were going to go through. Wellmont said they got past pre-employment check. That's a big thing. There's a lot of things that can go wrong in a pre-employment check. So, to me, that is extremely important. They picked up our employees. They never hesitated. They always stepped forward. They said they'd do what they would do, and they do what they say they're going to do. They built hospitals. They built 4 in the last 4 years. Wellmont, I haven't seen the one they built, but I've seen 2 that they closed. And just recently they closed one in Lee County. And we had our first meeting, just a preliminary meeting with Wellmont. I listened to Mr. Narvez talk. In fact, I just come back to the first meeting I've been back since having my second heart attack and second open heart surgery in May of 2012. And I sat and listened to what she had to say. And I asked her the question. I said, Mr. Narvez, sitting here listening to you, I understand that you do not want our nursing home. I understand you really do not want our hospital facilities. You do not really want our employees. But the thing you want is our certificate of need, so that you can go to as close to the Washington County line as you can get. And to her credit, she said yes. And of course, they have come along with their bids as we move through the process. But as I said, it's important for us to make sure that we take care of our 230 employees, take care of the hospital. And as I said, buck stops here, and it's time for us to start to make a decision. So with that, having heard an update on the conditions of the hospital, having reviewed the proposals and documents, having listened to the public comments, having discussed and deliberated the foregoing, I now will entertain a motion.
Mr. Chairman, I'd like to make a motion. Again, I'd like to add a little bit to what I said previously. Oh, okay. I'm going to get a little bit hoarse. It's been a long evening. I know you're getting impatient. But add one more thing to it. There's nothing more important to this community in addition to having their own community hospital. Jobs is very important. And out of those 230 jobs, if the hospital was moved out to Washington County, Carter County line, close to it, most of those, if not all, but majority of them would disappear. Jobs are very important to those because the employees would come from Carter and Washington County. So the jobs are very important, and the hospital is very important to be located, centrally located in Unicoi County. With that said, Mr. Chairman, I do have a motion to make, and according to our council here, there is a resolution to be made along with this motion, and it's not too lengthy, but I'm required to read this. So I'll begin this. We were given a resolution with a blank space in it, with no name, and whoever makes a motion is to insert the name of one of the 2 hospitals, and then the board will vote on which one they choose, or vote on the motion. Whereas the Board of Control of Unicoi County Memorial Hospital Incorporated, and referred to as the hospital, submitted a request for a proposal to the Mountain States Health Alliance and Wellmont Health Systems regarding the future of the hospital, including the sale of the hospital. Whereas each of the Mountain States Health Alliance and Wellmont Health Systems submitted final and best proposals to the hospital. Now, therefore, be it resolved that the Board of Control hereby accepts, authorizes, and approves the proposal from, and I've inserted Mountain States Health Alliance, the proposal. Further resolved that the chairman, president, vice chairman, secretary, and treasurer of the hospital, or any of them, are hereby authorized and directed to execute and deliver a letter of intent and definitive agreement to Mountain States based on the proposal and other documents necessary to implement and give effect to the proposal, together with such changes, additions, and deletions thereto, and such additional documents, agreements, and instruments as shall be approved by the officer and such officer's sole discretion, which approval shall be exclusively evidenced by the signature of such officer on such letter of intent, definitive agreement and or instrument, and the hospital is hereby authorized to undertake, fulfill, and perform all of the obligations of the hospital pursuant to the transaction document and any and all documents, instruments, and agreements necessary to give effect to the proposal and the foregoing. Further resolved, the Board of Control hereby approves and authorizes the transaction documents as well as any and all other documents contemplated thereby, and the consummation of the transaction contemplated therein, included all necessary or appropriate actions regarding the benefit plans of the hospital, and the account balances and benefits thereon or thereunder of said affected employees as a result of or relating to the transaction documents and the proposal, and which need the approval and or action of the Board of Control of the hospital. Further resolved that the Board of Control hereby approves, ratifies, confirms, and adopts all actions previously taken by the Board of Control and the officers of the hospital relating to the proposal, the transaction documents, and carrying out the purpose of the foregoing resolutions. Further resolved that the proposal, as reflected in the transaction documents, is hereby recommended to the town of Irwin and the county of Unicoi and their consideration and approval. Further resolved that in light of the dire financial condition of the hospital, which was reviewed by the Board of Control during the meeting, the Board of Control urges the town of Irwin and the county of Unicoi to act upon the recommendation as soon as possible. Further resolved that the Board of Control hereby authorizes and directs each of the officers of the hospital to do or cause to be done in the name and behalf of the hospital, and any and all such other acts, deeds, and things, and to sign, seal, and acknowledge and verify, and to deliver any and all such certificates, undertakings, assignments, agreements, and as any such officer may deem necessary or desirable in order to perform and satisfy all of the hospital's obligations under the transaction documents, and to give effect to the proposal and to carry out the purpose of the foregoing resolutions. Further resolved that an officer of the hospital, including but not limited to the chairman, vice chairman, president, treasurer, and secretary, is hereby authorized and empowered to vote the shares of the Unicoi County Medical Services Incorporated, UCMS, to give effect to the proposed and transaction documents, and to otherwise take such actions as any such officer may deem appropriate or necessary in order to cause UCMS to carry out and give effect to the agreements and transactions authorized hereby, and the intent of these resolutions. Further resolved that these resolutions take effect immediately upon their passage. So moved.
Okay, I have a motion. Do I hear a second?
So moved.
I have a second. Any further discussion? Hearing none, having heard the motion and a second, the member of the Board of Control of Unicoi County Memorial Hospital shall now vote with roll call vote. Ms. Bennett?
Mr. Bracken?
Yes.
Mr. Chandler?
Yes.
Mr. Irwin?
Yes.
Mr. Love?
Yes.
Dr. Wegman?
Yes.
Ms. Wilson? No one was more disappointed than I was on Tuesday morning when I saw the headline in the paper.
Without any notification whatsoever. But we have our employees in our long-term care, and my name is on one of those beds. And I too, Mr. Brackens, was born in the old hospital. And I vote yes.
Mr. Ray?
Yes.
Vote unanimous in favor.
Okay. Motion carries. Unanimous. Motion accepted. The proposal for a non-state hereby passed. Okay, do I hear a motion to adjourn?